so hush-hush about this. This is about HPV, the virus. So I'm going to be showing you some not so pretty pictures. I will be showing you I'll be showing you on how this virus will look on your body. So you can open your eyes, check yourself, check your partner, your husband, your wife, and get yourself vaccinated before you get this ugly disease. Alright? So what is HPV? Have anyone heard of it before?
Yes.
I hope you all have.
Yes.
But anyway, I'll tell you about it. Human papilloma virus, HPV. It is actually a huge family of viruses, and you've got more than 200 that actually affect the human body, and more than 30 that affect your private parts. Okay? So these kind of things nobody talks about because it's all hush-hush. We Asians keep quiet. But it is something that happens to almost every person, especially those who are sexually active. Alright? Sexually active, which means even if you're married, even if you're not married, as long as you have been sexually active, you are at risk of getting this disease. Okay? It seems like nobody's heard of it. It's actually because we never take the time to see what this disease does to our body. More than 30 different viruses affect our body. And most of the time, we don't even know it. It comes, it attacks us, and then it goes away, and we didn't know it came. Alright? So this is my duty today. I'm going to tell you all how it looks like, what it does, and how we can prevent ourselves from getting it. Alright? Okay, so HPV, human papilloma viruses, more than 230 affect the private parts of humans. Alright? Who gets it? More than 20 million people get it at any one time in a year. 20 million people. That is scary because it means it could be any one of us, right? So we need to be very sure what this thing is going to do to us. A lot of times, it just comes as little warts. You know those small things that you see on your mouth? You can see it on your hands. You can see it, you know, sometimes you get a sore throat, you go to see the doctor, and the doctor says, oh, you've got something in your throat. It could be human papilloma virus. Sometimes it can just be, this is a picture of someone's hand. And he just came to the doctor and he said, wow. For everyone who woke up, thank you for joining us. Okay, so this patient just came in and he just said, well, I've got these things on me and it keeps growing and I don't know what they are. And after we checked it, we found out, look, this is human papilloma virus. And he didn't even know. Things like, well, okay, it's the most common sexually transmitted disease ever. Forget about AIDS, forget about your herpes, your gonorrhea, and all the things that you learned at school. This is the most common, and it most of the time goes undiagnosed. Now the problem with human papilloma virus is two things. It causes warts, which can get really big, really nasty, and can affect you. And the other thing, especially for women, cervical cancer. We talked about breast cancer just now. You missed your sogi. Now I'm going to tell you about cervical cancer. It's not something you can feel. You can't just press and you say, whoa, I've got a lump. No, you can't. It's not something that would, you know, you will just suddenly realize, I think I've got cervical cancer. It doesn't appear that way. By the time you have symptoms, it's already too late. It's too big. It's probably incurable. You need major surgery, right? So that is the problem with human papilloma virus. So look at this picture here. I hope you all don't puke. Please don't. This is someone's lips, and these are all the warts. So it can happen anywhere. It can happen on your face. It can happen on your hands. It can happen on your thighs. It can happen on your private parts. It can happen on your backside. Everywhere. It can affect any part of your body. And it depends on which virus it is. The ones that affect us most at our private parts, which is the most common sexually transmitted infection, is your HPV 6 and 11. Alright? Got to remember those two numbers, 6 and 11, not difficult. The ones that affect us to get cancer, most of the time, is 16 and 18. Okay? So there are only 4 very important numbers that you need to remember. 6, 11, 16, 18. Okay? Now, this is a picture when a doctor checks inside. Alright? And then can you see that it's whitish over here? It's kind of a lumpy thing. Now that, ladies and gentlemen, is cancer. Okay? And you don't want to see this, and your doctor doesn't want to see this, right? So we need to do screening regularly, and we need to protect ourselves even before it can happen. Alright? Okay, this is disgusting as well. This is how warts look like. They look like this lump with cauliflower looking thing. It is disgusting. A lot of people, because it is your private area, you don't want to tell anybody. Because it doesn't bleed, it's not painful, it may be a bit itchy, but a lot of people, they just want to keep quiet until it gets too big. This is another picture of cervical cancer. It can grow very big, and nobody would know until it's too late. In this case, you see it's already started bleeding. That's probably why the person went to the doctors, got treated, and found out, look, you've got cancer. Alright? I'm sorry if the pictures are scary, but you know, if you don't see them, you're never going to realize it. And you're never going to go find help. So, people have been talking about HPV vaccines, especially since 2010. That's when the government introduced this HPV vaccines for 13 years old. If you wear your uniform, you go to a government clinic, you can get vaccinated for free. So HPV vaccines, they're actually quadrivalent vaccines that, remember the 4 viruses that we talked about? 6, 11, 16, and 18. The HPV vaccine protects against those 4 viruses. Alright? So what does it do? For a person who is sexually active, even for kids, it was recommended actually from ages 9 till 26. This is the best time for you to get vaccinated. Why? Because before it happens, we want to get protected. If it has already happened, we want to protect against those 4 and any type of virus that is similar to it. Okay? You don't want to get cancer. You don't want to get warts. So you practice proper screening, cervical screening, as well as get your vaccines. Alright? So how do we do vaccines? Vaccines are basically little proteins that look like the virus itself. And these proteins, they've made it safe to enter our bodies and for our bodies to produce enough immunity against those 4 viruses. Alright? So it's not dangerous in the sense that you're not putting a live virus inside of you. It's just a protein. It comes in 3 doses. The first one, 2 months later, and 6 months later. That's it. 3 doses. That's it. Okay? But the immunity that it gives you, that is priceless. You don't want this disease in you. Right? The other thing is Pap smear. Pap smear, I don't know if you all done it, I don't know if you all know about it, but it's basically what we need to use, a tool to screen ourselves. Alright, we go to the clinic, the doctor just puts in a small little device to look inside, they take samples from the cervix, the picture I showed you just now, take all the cells, well not all the cells, just a bit of cells, and they put in a slide and we look it under the microscope. If it's normal, great. If it's not normal, we got to go for further management. Alright? cervical screening is important. No matter what you feel, you may feel uncomfortable going to the doctor and say, I want a pap smear, I want you to check me. Nobody does that. But for your own safety, your own health sake, that's what you gotta do. Okay, so now you've seen all the disgusting pictures. You know, one thing is, you gotta check yourself. Do I carry this disease? Do I have things like this on me? Check yourself. The other thing, check your partner. If you are staying with somebody, you are actively in a relationship with somebody, check your partner. Make sure that they do not have the same things, that I've mentioned before. Screen yourself. Do your pap smears. And most importantly, get yourself vaccinated. Okay? This is a life-changing thing. You don't want to get cancer. You don't want to get these warts. You don't want any more health burden on you. Alright? I think that's all. Any questions? No.